In any normal individual with a blood glucose level below 60, they should have a near complete suppression of insulin secretion. Remember that insulin is an anabolic peptide hormone. It's produced and secreted by the beta cells located in the islets of Langerhans in the pancreas. And the primary role for insulin is for modulating glucose absorption from the blood and lowering the blood glucose levels. When you run into a question or a patient with a very low glucose level, but they have an inappropriately elevated serum insulin level, there are two very important causes of this hypoglycemia in non-diabetic patients with these elevated insulin levels. The first thing you should think about is an insulinoma. This is where the patient may have a beta cell tumor. The second way that they can have this type of presentation is that they have an inappropriate surreptitious use of insulin or a sulfonylurea. What you do is check for the C peptides and the proinsulin levels together. When these levels are greater than 5, then you see this in patients with beta cell tumors. When you're using insulin or sulfonylurea surreptitiously, you should have an increased output of endogenous insulin from your beta cells. This is hard to differentiate with someone with an insulinoma because both their insulin and their C-peptide levels are going to be elevated in both groups. So the best way to confirm your diagnosis is to measure the plasma sulfonylurea level. In contrast, if someone had exogenous insulin-induced hypoglycemia, they would have very high levels of insulin, but they would have very low levels of C-peptides because it's not endogenous insulin production that is being excreted. Now here's a twist. If a patient has hypoglycemia, but their insulin and C-peptide levels seem suppressed, this could be because of a non-beta cell tumor, such as a very large mesenchymal tumor. These type of tumors produce IGF-2, which acts like insulin after binding to insulin receptors, which is why they have suppressed levels of insulin and C-peptide. You can help diagnose this by checking the IGF-2 levels.